This is provocation alleviation with flexion and extension. And basically what you want the patient to do first is kind of test what their normal range is and where they start having pain, whether it's in flexion or extension. So I'm going to ask you to bend forward slowly and tell me when you start to have pain, if you do.
Right there.
Okay, you do. And then I'll go ahead and go back to the middle. And then extend and let me know if you have pain.
Oh, nothing here.
Okay, so you're good in extension. And so what I want him to do now is stick. Where's the pain go? Does it go on one side specifically, or?
It's kind of just like here.
Okay.
I don't really know where.
So if it's more going down his left side of his body, I want him to stick his left leg up on the stool. Do you have any pain with that? Okay, now I want you to bend forward slowly. You get.
Oh, right there. Sorry.
Okay, he gets pain a little bit earlier in his flexion than he does with when he already has hip flexion, and so you'd suspect it might be a hip problem. So go ahead and put your leg down. And then you can do the same thing with extension, in which case, if it was extension, he would just stick his leg back, and then you do the same thing, have him flex forward until he starts to get pain. And you'd expect that he would have more if it's a problem in the hip.
But if not, we continue.
Yeah. Okay, so the next thing you do, this is basically the same thing as we just did. It's like an alternative. You could grab the pelvis and kind of facilitate.
Barrier first.
Oh yeah, we want to establish the barrier. Okay, so go ahead and bend forward until you start to feel the pain.
There.
Okay, now come out of it just a little bit.
Okay.
Alright, go back into it. Alright, go ahead and come just out of it, just when it goes away.
Okay.
Okay. And now if I tip his hips forward in anterior tilt, how's that feel?
Worse.
That feels worse because an anterior tilt is going to facilitate, or it's going to mimic flexion. And if I do a posterior tilt, it's going to be more of hip extension.
He does put me in symptoms then.
Oh yeah, okay. So yeah, go ahead and go just into the pain. Alright, then you do a posterior tilt, and you should feel, how do you feel?
Better.
Okay, it feels a little bit better.
If it was hip.
Yeah, if it was hip. Right, the next one, when we're talking about sacral, so what I want you to do is go ahead and just go into the barrier of pain. Right there. Okay, and now what I'm going to do is I'm going to essentially flex the sacrum, which is called nutation, and I want to go to the base of the sacrum, which we're just going to say is right here. I can't tell if these genes and belt and stuff, but I want to go around it, grab the ASISs, and I want to give it a push, and he should be just out of pain, and so if I press it, then I would ask him, how do you feel, better, worse, the same?
The same.
The same. So I mean, if it was sacral, you'd suspect that in flexion or nutation, he would increase in pain. And now I'm gonna have you go just into pain again, or just into pain this time rather than just out of pain.
Okay.
And I'm gonna press on the coccyx. Where's your coccyx?
The apex of the base, or apex of the sacrum.
Yeah, apex. And so it should be like right around here. And if I press that with a 2-finger grip.
No change.
No change, but if it was sacral pathology, that might make it better. Okay, and now for lumbar spine, we're going to press on the vertebrae. So go ahead and bend forward just when you get into pain, and then come just out of it. Okay, and so I'm going to try to find L5. Okay. And I'm going to apply a ventral and cranial force when he's just into pain. Is that right?
No, when you're just out of pain.
When he's just out of pain.
So you're trying to alleviate pain.
So
or provocate, I'm sorry.
Okay, yeah, because if I press up ventrally and cranial L5, above it is going to extend and below it is going to flex. And so I'm going to go ahead and apply that force.
Nothing there.
Okay. I'm going to go to L4. Try to relax your back a little bit. It's hard to find the spinous processes. How about that?
That hurts.
That hurts. So if he's just, are you just out of pain right now?
Yep.
Okay, so if he's just out of pain and I press it and it hurts, then you might expect that L4, L5 motion segment is where he's getting his pain. So the disc between L4 and L5, because I'm flexing it, and then I would keep going all the way up to the vertebrae just to see.
And you can also do alleviation by putting him into the pain and pushing into lower lumbar. That should relieve
okay.
it because that puts into extension.
Okay, I'll do one of those real quick. So
Right.
let's go just into the pain for me.
Okay.
And so if he's just in pain, and I press on the one right below it, I'm going to be extending. So